And we are live again for another short crash webinar on post-operative care in cataract management. So this webinar came as a result of a meeting we had on the group chat of eye leaders where issues were raised on how to manage cataract, and then it prompted me to quickly prepare this slide so that everyone can be well equipped on how to manage cataract operation after the surgery. So I'm going to be dedicating this video to Nurse Aliu. She is an exceptional ophthalmic nurse currently practicing in 661 Nigerian Air Force Eye Clinic Ikeja. She is vast and humble and teachable, and she taught me some of the things I know today in management of cataract. So this video is dedicated to her, and I hope she sees this. So quickly, we are going to be looking at the introduction, preoperative ocular assessments. We're also going to be looking at post-operation, and then drugs administration, finally conclusion. So quickly, the introduction. The lens is a transparent biconvex crystalline structure placed between the iris and the vitreous humor. It is transparent due to its avascular nature and characteristic arrangement of the lens fibers. The lens helps to absorb, focus, and direct incoming light on the retina. So the lens is very, very vital in vision. And again, the lens is focused on the retina. Light is focused on the retina by a process known as accommodation. Cataract is the formation of opacity in the lens. So every time there is an opacity in the lens, we call it cataract. And this opacity should be sufficient enough to impair vision. There are different kinds of cataract. I won't be going into that because of the scope of our study. But those who are professionals in the field know that there are different kinds and types of cataract. So what are the pre-ocular assessments or the pre-operation ocular assessments we want to do before the patient goes to the theater? The first is case history. We want to do a detailed and comprehensive case history, knowing when the cataract occurred and what's going on, excuse me. So case history is very, very important. The next is visual acuity. It's important to note the visual acuity of the patient before surgery is being done for both eyes. It's important that we note the visual acuity. The next is we want to also note the intraocular pressure of the eyes, because when the intraocular pressure is high, we wouldn't want to go further with the cataract operation. It's important that we know the normal intraocular pressure, which is 11 to 21 millimeter mercury. And the next day, we want to examine the external, want to do external eye examination. Usually best that a dilated fundoscopy is done, so that to ensure that of a truth the cataract is matured. And again, we also want to do a dry eye assessment. Dry eye assessment is also very, very important. Also during the dilated fundoscopy, it is important that the macula is examined to be sure that the macula is healthy and functioning properly. And then keratometry is done, and finally ocular biometry is done. So your ocular biometry will need your keratometry readings in order to determine the power of the intraocular lens that will be inserted after the surgery. Also, the macular function test is very important, and there are few techniques you can use to determine the health of the macula. The first is the true light discrimination test. The second is the Maddox rod test. The third is the color perception, and fourth is the entopic visualization. So all these tests are important to note the health of the macula and make sure that the macula is healthy before the cataract operation begins. So before the operation, it is expected that the patient signs a consent, and it is wise that the consent is signed with either a family member or a close friend. So the patient is consenting that, yes, I'm aware that an operation is going to be done on me, and I'm saying go ahead to do it. So this is very, very important. So after the patient signs a consent form, The patient is sent to the laboratory for some important tests such as the FBS, fasting blood sugar, 2-HPP, HCV, HBsAg, HbAIC, and HIV tests. All these tests are very, very important because if the sugar level is high, we might not want to undergo this operation. So we want to make sure that the sugar level is within control. We want to make sure that there are no issues systemically happening. So this is why we send for this test. So after the patient comes back with the result and it shows that it is all these tests sent for are negative, it's important that the patient is counseled effectively. So the patient is told to have a thorough scrub bath because after the operation, sorry, excuse me, I've not been feeling so fine. So after the operation, the patient is expected to have limited movement and not engage in so much activities like bathing. So it is expected that the patient has a thorough scrub bath before the operation. And for the males, they shave off their hair because they won't be shaving their hair or their beards for the next 6 weeks. So it's important that they shave off their hair and their beards. And for during the day they will come for the operation. The patient is expected to eat something light and also wear a clothes that can be buttoned up and down, not a clothes that can be removed, but a clothes that can be buttoned, so that when they want to remove the clothes, you just unbutton and remove, not a clothes that can be pulled, because don't want any contact with the head region. So it is important that this is told to the patient, and also the eye to be operated on should be marked. It should be marked. Some clinics use a plaster or whatever it is, but the eye should be indicated so that the ophthalmologist won't go into the theater and begin operating on the wrong eye. And again, it is important that the blood pressure is under control. For patients who are hypertensive, we might not want to go ahead with the surgery. We might want to ensure that the pressure is crashed. And also, like I said earlier, it is important that the intraocular pressure is not also high. So after the surgery, the patient is asked to lie down facing upwards for about 2 to 3 hours because a new lens has been inserted into the posterior chamber. So the patient is expected to lie down facing upwards. The patient is not expected to be bending down or trying to lift up heavy things or climbing a step, coming down. No. The patient is not expected to even bathe the head region because we don't want water entering into the eyes. So diclofenac might be given for mild to moderate post-operative pain. And then the next morning, now this is the most important aspect of this session because what we are looking at is post-operative care. Now, the next morning, the patient is expected to be in the clinic the next morning of the operation, and before the eye is opened, it is expected that a thorough counseling is done. Now, most times these surgeries can be done in groups, and then patient A expects that, oh, since patient B is saying 6-6, I too I should see 6-6, or because patient C he didn't have any complication, I too shouldn't have complications. So it is important to let the patient know that the way our eyes are different, so the outcomes will be different. Are we together? It is important that the patient is counseled that he should not begin to judge his own experience with that of the another person. That is when the operation is done in group. So the patient is quickly counseled on not to expect so much or begin to pressure the eyes to see so much. No. So that counseling is very, very important. So after this counseling is done, the eye has been bandaged. The bandage is removed gently. It is removed this way out, not this way in. It is removed temporarily because you don't want to infect the eyes again. So the bandage is removed from the nose to the temple temporarily. And after the bandage has been removed, a gauze is soaked in saline water, thoroughly soaked in saline water, and is used to clean the eyes. So assuming it is my left eye that was operated, a gauze is soaked in saline water and then it is cleaned temporarily, not nasally. So the eyes are cleaned temporarily this way, away from the nose region. It is cleaned thoroughly so that there will be no debris or there might be discharges blood. So these things are cleaned temporarily away using a clean wire gauze. So this can be done 3, 4, 5 times as the case may be until the eyes are thoroughly clean. So while this is done, the doctor or the ophthalmic nurse who is doing this, while he's cleaning the eyes, he's also doing a quick assessment of the eyes to know if there are or will be any complications. So while the eyes are being cleaned, a quick examination is done to look at the eyes to ensure that the eyes are not like what is expected is seen. Are we together? So now, after the eyes are thoroughly cleaned with saline water, with a wire gauze soaked in saline water, the visual acuity of that eye is noted. So we want to note what is the visual acuity after operation. Sometimes before operation, you can see a visual acuity of, let's say, 660, and after operation, it might even be worse, it might be better, or it might be the same, but there's no cause for alarm. So the visual acuity is noted. I personally, I don't like doing pinhole because I do not see the need for pinhole because the eye just underwent surgery. What are you trying to do a pinhole for? So that is my own subjective method. I don't usually want to do a pinhole, so I just go for the visual acuity, and then it is noted for distance and for near. And also tonometry is done after the visual acuity. We want to know the intraocular pressure. There are cases whereby after cataract operation there is a spike in pressure. So it is important to know this because this will also guide you in your drug choice when after you've done your slit lamp examination. So tonometry is done quickly, and then after that the patient now comes for external eye examination using the slit lamp. So the slit lamp is the instrument of choice, not the pen touch. The slit lamp is the instrument of choice for external eye examination. So after the visual acuity, after the tonometry, the patient is seated, and then before the external eye examination is done, the doctor quickly asks the patient, how are you feeling? So it is important to note that the patient might have feelings of mild pain, heaviness, foreign body sensation, blurry vision, headaches. These are normal after cataract operation. It is normal to experience these things, like I said earlier, a foreign body sensation, a pain, mild headache, whatever it is. These are normal. Blurriness, these are normal a day after cataract operation. And then during external eye examination using the slit lamp, there are structures we want to note, and these structures we want to examine them and be sure that there is no anomaly in them. So the first structure we are looking at in the external eye examination using the slit lamp is the lids. So it is normal it is normal for the lids to be swollen after a cataract operation. It is normal. So we want to look at the lids and ensure that they are not lacerated, and if they are lacerated, we note it down that it's lacerated. Also, the next structure is the conjunctiva. So most times, but not all times, often after cataract operation, you might see hyphema, accumulation of blood in the conjunctiva. It is not so much, nothing to worry about. These are the common complications after cataract operation. So there could be cases of hyphema, blood clotting, accumulation of blood in the conjunctiva. So we want to note it and also note it down in our records. The next structure we are looking at is the cornea. So after cataract operation, there might be cases of hazy cornea. So if the cornea is hazy, it is one of the complications of cataract operation. It should be noted that the cornea is hazy, and then the degree, is it mildly hazy, is it moderately hazy, or severely hazy? So this should be noted down by the doctor who is doing the external eye examination. Then after the cornea, we want to look at the anterior chamber. So we are making sure that there are no flares, there are no blood clots there. There is no white blood cell or red blood cell in the anterior chamber. There are no flares. So because if we begin to see cells, they are likely uveitis is setting in. So we want to make sure that the anterior chamber is clear, because sometimes the patient might want to go in for what we call SLM, soft lens material washout, which is usually deposited in the anterior chamber. So that is a topic for another day. So we want to look at the anterior chamber. Also the pupil. We want to be sure that the pupil are reacting to light. It is important that the pupil is reacting to light, and also the excuse me, the iris. The iris should be noted. There are times whereby you see iris displacement. These are some of the common complications of cataract operation. So we want to be sure that the iris is well placed, and then the lens, the artificial lens that has been inserted, is also sitting properly. So this is a quick one on the external eye examination. So this external eye examination is done quickly because at this point the eyes are very, very sensitive to light. At this point the patient is not even comfortable placing their head on the slit lamp. So the doctor should not spend the whole day there trying to look at it. It should be a quick assessment, and then quick but yet not missing important details. So after this, we now go to the drug administration. What are the drugs we give after cataract operation? So because of the complications, these are the drugs we will be giving. The first is sodium chloride. Because of the most times, not all times, most times there might be cases, or there might be a case of corneal edema. So we want to give sodium chloride. I think a brand name for that should be salicin, and this is given. It should be instilled every 2 hours after the operation. Every 2 hours. That is the day after the operation. The sodium chloride is instilled every 2 hours. And then the next is steroid eye drop. Steroid eye drop should also be instilled every 2 hours after the next day of post-operation. And again, antibiotics eye drop should be instilled also every 2 hours. Every 2 hours in that eye. The next is antibiotic ointment, which will be instilled at night, morning and night. Morning and night. For some practitioners, they prefer only at night. Some doctors will say morning and night, so it depends on your discretion. And again, NSAIDs should also be instilled because of the pain that comes with the operation. So NSAID is instilled every 4 hours. Every 4 hours, NSAIDs should be instilled. And also artificial tears should be given and instilled 3 times daily because of the foreign body sensation they might be having. So we also give artificial tears. And prednisolone might also be given. Prednisolone tablet might be given depending on the doctor's discretion, 10 milligram daily, depending on the dosage, and the giving of the prednisolone is not a must. It's based on the doctor's discretion and what he sees that prompts him to give the prednisolone. So for cases whereby the pressure is high after the cataract operation, a combination of dozolamide and timolol is given to be instilled in the eye, and this is done twice daily. That is a brand like Misopt, Cosopt. A combination of dozolamide and timolol is important. And for intraocular pressure that is above 30 millimeter mercury, it is also important that acetazolamide tablet is given to also help crash down the pressure. 250 milligram twice daily, and also that should be augmented with Diamox 600 milligram once daily. So this is for cases where the intraocular pressure is very high. So follow up. The patient is expected to be in the clinic the next week, a week after, for a routine check again. So when the patient comes a week after, we want to check the visual acuity, and note that the visual acuity is there should be an improve in visual acuity after 1 week. There should be also a crash in the pressure if the pressure was actually high. So after 1 week, the patient is expected to come back to the clinic, and the doctor should also should be wise enough to ask and ensure that the patient is adhering to instructions. The patient is expected to remain indoors during these 6 weeks of recovery. For some patients, you find out that after cataract operation, you see them going to work, going to their marketplace. This is highly prohibited. So these 6 weeks after surgery, the patient is expected to stay indoors, limit movement of going to church, going to mosques, going to market, cooking, whatever. The patient should avoid bending down, looking up, or doing those things they used to do before. So movement should be highly limited, and the doctor should ensure that the patient adheres to this, because if the patient doesn't adhere to this, there can be complications. Are we together? So common complications after the cataract operation. The first is hyphema, like I said earlier, accumulation of blood. Hyphema is a common complication, and if there's hyphema, there's no so much to worry about. It's going to subside on its own. The next is iris prolapse. So where we notice an iris prolapse, the patient should go back to the theater, and then the iris should be properly positioned. The next is striate keratopathy. This is due to the endothelium of the cornea have been compromised, so there can be accumulation of fluid in the cornea. So this is why we give sodium chloride in order to draw out the fluid from the cornea. And again, there could be another complication, could be toxic anterior segment syndrome. Another could be endophthalmitis. In fact, personally, I feel endophthalmitis is the most severe complication after a cataract operation is done, and it can lead to blindness. So this is why the patient must come back a week after, so that, because once we catch a glimpse of endophthalmitis, it should be tackled immediately. It should be addressed immediately. If it is not addressed immediately, that patient can lose the eye and can even lose the other eye, because it's an infection, it can go to the other eye. So it's important that the next week the doctor is checking for endophthalmitis, making sure that there is no sign or clue for endophthalmitis. So another common complication is post-operative arterial uveitis. In this case, you may begin to see cells in the arterial chamber, and they should be tackled immediately. Systemic macular edema is not an early complication. Usually occurs sometimes months after the operation, but yet it should be noted. And for that, your OCT result will show that there is a cystoid macular edema. Another is pseudophakic bullous keratopathy. It's another complication from cataract operation. And then finally, retinal detachment. So these are not just limited to this, but these are the common complications we can see after a cataract operation. Then finally, refraction is not done immediately. Refraction is done after 6 weeks post-cataract operation. That is when refraction should be attempted, because the eyes is healing. So it's important that we give the eyes time to heal properly. So refraction is done after 6 weeks post-cataract operation, but then we don't dispense after 6 weeks. It is important that you get your whatever prescription you get and notice. Then a week or two after, maybe from week 8 to week 9 post-cataract operation, the final prescription can be done, and then glasses can be dispensed. So this is just a quick overview on post-operative cataract care management. So if you have any question, feel free to drop your question on the comment box, or if you're on the WhatsApp platform of IDAS, feel free to drop your questions, your observations, your contributions. They are highly important to me on the comment section. So make sure you like this channel. Please endeavor to share this video, and also subscribe to the YouTube channel. As you do this, God bless you. We'll see in our next class again. In my next class, I'll be teaching on CVF interpretation, and I hope to see you there. Good night, and God bless you.